What kind of orthopedic birth defects are there?
Oh my God. Most of the orthopedic birth defects we call failure of formation or failure of separation. The latter is the most common. For example, fingers that are fused together.
Okay.
And interestingly, one of the most moving experiences of my life happened this last time I went to Honduras, which was about 6 months ago. I brought with me a pediatrician who's going to be a surgeon. They're generally trained in Ecuador first, and this was the first child that I've ever operated on overseas. Went and actually brought her to the United States for several surgeries because 20 years ago we couldn't identify a teaching hospital, so I brought this little girl back, and she lived with us for 6 months. Did multiple surgeries on her in Ecuador and at my house when she lived with us. And then she became a doctor and was actually my first assistant.
Oh, wow. What a great story that is.
Isn't that the best?
Yes.
And so now she's treating COVID cases in Ecuador. She has a year of general medicine to donate back to the society, and then she's going to an orthopedic program, and then we're going to try to get her into the University of Miami for her hand fellowship. So she'll be the first hand surgeon in Ecuador.
Wow.
So.
What kind of surgery did she have? All those multiple surgeries? What was her underlying problem?
Well, let me see if I can find some pictures, and maybe your partner can put them up.
Sure. You have to email them to him. But.
Okay.
Or I don't know. He's pretty.
Oh, we'll try. So
we'll do that on the break.
She had all of her fingers fused together, and I lost track with her for probably 10 years. She tracked me down through LinkedIn. Who would have thought? And I don't do social media very well. And so I was on LinkedIn, and a little bit later she tracked me down. And so her name is Alba, A-L-B-A, and so I was ecstatic to hear from Alba. So now I'm really avidly participating in social media to communicate with her. And she sent me pictures of her playing a guitar, her examining people. She literally had 2 mittens for hands. I separated all of her fingers.
Oh, wow.
Right. So she's able to play guitar and things. So it's great successes, obviously. So failure of separation is one, and that was what Alba had suffered from. And then there's a failure of formation. There are children that are born without a thumb, and so we move an index over to make a thumb, or we'll move a toe up to their hand to make a thumb. A club foot is critical to fix in poorly developed countries, or resource poor countries is a better term, because as an adult they won't get a job. So if you can fix a child, a little boy before around 9 months of age, because they start walking about 9 months to 12, you can really make a dramatic impact on his life. So, and then our time is limited and our resources are poor, so it's tough on us to make a decision. Do we fix a 9-year-old with a club foot that's moderate, or do we fix a 16-year-old or a 25-year-old with a severe club foot that can't walk? So those are ethical decisions.
Those are tough decisions.
Right, they're tough decisions, and in my mind, I always pick the 9-month-old, because if I can fix his foot and he can walk normally, I've impacted his whole life.
Right.
Whereas that 26-year-old, it's much more difficult to fix. He's accommodated for it in his life, and they're best served by other means. So. The best means to serve them is to teach their doctors how to fix club feet, and then that he can go on their schedule.
Right.
Right.